Welcome to STO's Voices in Oncology. I'm Amy Fazo, and I'm joined with my co-host, Amy Depew. Hi, Amy.
Hi, Amy.
Today, we're talking about supporting patients across the ovarian cancer continuum with the National Ovarian Cancer Coalition, also known as NOCC. While advances in treatment continue to improve outcomes for people living with ovarian cancer, we know that comprehensive cancer care extends beyond the diagnosis and treatment. Patients and caregivers often need support navigating all the other challenges that come with a cancer diagnosis. So patient advocacy organizations like NOCC play an important role in extending the care team, providing resources, guidance, and support throughout every stage of the cancer journey. Joining us today is Jennifer McClendon, Education and Missions Program Senior Manager at the NOCC. Jennifer works with the NOCC to support patients, caregivers, as well as healthcare professionals by connecting individuals with resources that help address barriers to care. Today, we'll discuss why whole person care matters, how patient needs evolve throughout the ovarian care continuum, and how NOCC's financial and resource support program helps patients access the support they need. Thank you for joining us, Jennifer.
Thank you for having me. I'm excited to be here.
We're happy to have you. To start, could you please tell us a little bit about yourself and what is your role and the organization's mission?
Sure, absolutely. So yes, as you said, I'm Jennifer McClendon, and I am our NOCC's Education and Programs Manager. So I basically oversee all of our education programs, our resources, and the services that we provide to patients. And of course, our organization is dedicated to improving the lives of people affected by ovarian cancer. And that's not just the survivors, it's also the caregivers. And we do that through various education efforts, advocacy, our support programs, and of course, making sure everyone has access to as many resources as possible. So we really just really aim to make sure that patients and caregivers and their families have what they need to get through this new journey of theirs. So from diagnosis to treatment to even after treatment, there's lots of different paths that one can take, and we want to make sure that we can support them along all of those paths. So yes, in my role, I do have the privilege of working very closely with patients and caregivers and supporting healthcare providers. We really just want to make sure that no one with ovarian cancer has to navigate it alone.
I'm excited to get to talk to you about some of these barriers of care. Could you tell us a little bit about that whole person care in oncology and maybe talk a bit about what it does in the context of ovarian cancer? Why is it really that important?
So whole person care, meaning that this is just beyond your physical symptoms, your physical body, right? As we know, medical treatment is essential. Patients are also navigating other things, such as emotional needs and mental needs and financial needs and social interaction needs, and as well as practical challenges. So, I mean, you name it, they're going through it. And so it's not just the physical bodies. And all of these things significantly impact their outcomes, how they respond to treatment, how they keep going through treatment. Specifically in ovarian cancer, many are diagnosed with advanced stage, unfortunately. And so that treatment can be very complex, but also ongoing for the rest of their lives. They're coping with a lot of uncertainty and managing side effects and balancing work and family responsibilities. If you're young, concerns about fertility and can I have children, financial stress, and all alongside these patients are their caregivers and their loved ones who are facing these challenges right alongside them. So whole person care means all of those things, bringing all of these together and also bringing together a multidisciplinary team. So whole person also includes not just your oncologist or your gynecologic oncologist, but also your nurse, your social worker, mental health professional, counselor, your dietitian, palliative care specialist, a patient navigator. I mean, I could go on and on and on. But just knowing that they have a support team out there to help address all of those individual needs, and those things can be accessible and patients can ask for those things is really important. It basically comes down to when patients have access to all of that support, they're often equipped to stay more engaged in their treatment. They're often more equipped to communicate more with their healthcare team and just overall have a good sense of well-being. So that's how I kind of define whole person care. It's not just the treatment, it's everything else that surrounds it that keeps them going.
The whole person is so important, and people are not isolated, as well as that multidisciplinary team really being
Yes.
critical, right, for that care. Can you describe how that care can change throughout this treatment journey? Because I'm sure initial diagnosis is different from once you go through treatment. And then if you're on
Mhm.
surveillance or have a recurrence, how does that support
Yeah.
change for the patient as they're going through their journey?
Different support needed at different times for sure. We know that every individual is unique and their needs really do change and evolve as their diagnosis does. I would say, starting at maybe diagnosis, I think patients are overwhelmed, frankly, just overwhelmed. And so they're processing a lot of, they're not only processing their diagnosis, they're processing a lot of life changing decisions while trying to understand all of the information that's being thrown at them. In some cases, especially with ovarian cancer, make those decisions quickly. So during this stage at diagnosis, the support that is needed there is really just clear education, knowing what support is available to them as far as emotional and practical, but also helping them navigate that healthcare system. There's so many questions, so many issues, so many obstacles, so many barriers that one person can take. And so helping them navigate that and putting them in touch with those different multidisciplinary persons is important. So that's kind of at the beginning. And then as your treatment begins, the focus really shifts to, okay, now I'm in treatment, I'm having these side effects. So I'm coordinating appointments, understanding your insurance denials, your coverage, how to navigate all of that, and then balancing work and family. So yikes, it's just a lot to be thrown at you. And then, of course, we can't forget the caregivers. They also need support because they're often the ones that are managing these medications and managing the transportation and taking off work and providing encouragement while coping with their own stress, which is something here at the NOCC we really strive to do, is support and recognize the strength of our
Mm.
caregivers. Then during surveillance, so after one finishes treatment, support may move to more mental health. Patients may experience more anxiety or the fear of recurrence. And so there is definitely different types of support that are needed along the way. And even when treatment has stopped or has ended for the moment, I mean, there's still ongoing education. There's still peer support, which can be very helpful, as well as survivorship resources. So your body changes, your mental health changes. So all of those things still need to be addressed. And then finally, for those that may be facing a recurrence, many of these things come back. And so just dealing with that uncertainty. And that's when practical resources like financial support or just having someone help you coordinate your care can be even more critical. Really, throughout each phase, we just want people to know that they're not alone and that there is support to help them through each of those phases.
I have to agree with all of that as well. You've used descriptive words to give a face to these patients with
Yes.
what they specifically need. One of the most powerful words that you used was empowerment. It kind of conjured up that picture of the patient walking through a door by herself, but then
Yes.
the camera pans out and there are all these helpful
Mhm.
faces who are there to help her and help the caregivers. You have explained that very well, and I do appreciate it. As healthcare professionals, how can we better recognize and maybe help address those barriers just as part of routine cancer care?
Just being open and asking simple questions. Maybe some open ended questions beyond how treatment's going. Questions maybe like, how are you managing at home? Are you experiencing any financial concerns? Do you have the support, that practical or the emotional support that you need? Kind of some simple open ended questions, maybe to even get them to think about what some of their challenges might be, even though that takes a little time. It's so important and can be so, so helpful for both parties. And it might uncover some challenges that may not otherwise have been recognized. The healthcare providers, you guys are so wonderful. You don't have to solve the problems, but you can definitely know what key resources are available and make those referrals and put them in touch with those different support resources. So organizations like ours, social workers, your financial counselors, your wonderful patient navigators, and all of those play a huge important role. So I think it's really just asking those simple questions. We know when that is integrated into someone's care, instead of waiting until they're in crisis and asking those up front, they're much more likely to receive the help that they need, which helps improve then their quality of life, and which helps then improve their outcomes.
Can you give us an overview of the programs that the NOCC does provide to patients and I believe you provide to caregivers as well?
We basically exist to make sure that no one faces this disease alone. We provide education resources, patient and caregiver education programs, support communities, whether it's through our support groups or our caregiver support groups. And we do various webinars and podcasts, as well as many opportunities in person through our various regions throughout the country where survivors and or caregivers can connect one-on-one in person with each other and provide that peer support and really help understand what they're experiencing. So we think that's one thing that kind of sets us apart and makes us unique, is that we do have that in-person connection where we can. And then we also offer various patient navigation resources, such as our financial and resource support program, or helps patients identify and access really, really vital resources that can reduce some of their stress. We have a free meal delivery program. We have grief counseling. So it's kind of like, as we mentioned throughout this conversation, wherever you are on your path, there's something that we can offer.
How do those resources complement the care that patients are getting from their oncology team?
I think that all of the resources really complement the outstanding medical care that's being provided, but we really kind of help complement some of those non-medical challenges that influence a patient's overall well-being. They can be given a lot of information and things thrown at them, which is a lot to intake. We can help patients navigate some of the available resources, but also address concerns that providers may not always have the time or capacity to manage during the busy clinic visit.
I love
We
that.
Yes, we love that extension because that is so critical when you are trying to treat the whole person, and
Yes.
patients can need care beyond the clinic.
Right.
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 And one thing I wanted to talk about is we understand that the impact of the financial
Mm,
portions of cancer care can have a lot of stress on our patients. And so, can you talk about specifically your financial
mm.
program? How does it work? Who can get referred to the financial program that you have?
Absolutely, yeah. So a lot of this came from COVID. So back in the COVID days when we were able to identify a lot of barriers that patients were encountering, including access to healthy foods and meals and finances and just all of the things that came along with that. We do know that, as we have been talking about too, that impact of cancer care extends beyond their treatment, but many significant financial strains and challenges are put onto these patients and families that really affect their ability to focus on their care and stay engaged in their care. And quite frankly, a barrier for many who don't continue their care, which is the sad part. We really wanted to step in and kind of create some assistance where we could to help individuals and families address those challenges. We established our financial and resource support program, which is really a whole team of case managers who work very, very hard at connecting one-on-one with individuals. And so individuals can call in and describe their situations, whether it's a financial crisis, they need a bill paid, they need help with transportation, they need meals delivered to the house, they need house cleaning, childcare. You can imagine someone might need all of those that I just mentioned at once. And so we really want to be available to help connect them to those resources. There's many great organizations and many great programs that are available, but it's so hard to, you as a patient, sit down and identify those for yourself. And so being able to connect with someone one-on-one where they can do that research for you and hold you by the hand and take you through is where we see this financial and resource support program helping. So you connect with a caseworker. They basically ask, what's your most immediate need, and then go from there. So the approach is very individualized, but the goal is really to reduce stress and remove as many barriers as possible and to help support them through their treatment. Even such a simple thing like yesterday, we had a patient call in and talk with one of our case managers, and I think her insurance company denied some sort of treatment. And this is like the fourth appeal she's gone through or something like that. It's ridiculous. And so they were able to, okay, stop what you're doing. Let us take it from here and handle the appeals process with a legal counsel. So they did all that for her and finished her
Wow.
case and got her reimbursed and also her treatment. So it's like things like that patients, I don't think, know that they can get help with. So we're trying to get that message out there.
Well, so for healthcare professionals, we're back to that treatment team. When is it the best time? When should they consider connecting one of their patients with your organization?
A lot of people wait until they're in crisis, but I think thinking about these things beforehand and kind of getting things aligned is really a great idea. So just thinking about your finances, how are you going to get to point A to point B if you don't have a car or if you've got someone who's working? What questions do you have about insurance, employment, all of those things? The earlier the better, because there is a lot that can come up. And I think just navigating those things earlier and kind of seeing where you might need support is really great. I think it's good for healthcare providers to know what resources are available out there as well, patient navigators, so that they can know when a good time is to make a referral. But even if patients aren't sure that they need assistance, having that conversation early about what resources are available can prevent some of those challenges from becoming bigger than they need to be.
It has been great to hear the amazing amount of resources that you provide for these patients. I bet that a lot of people aren't even aware that you do provide all of these
Right.
services. So, how can people make sure that they know how to find out more
Sure.
information so that they can look and see what is available for them?
Yes, we have our website, which is ovarian.org. And under our resources section, you'll find all the information about our financial assistance and our case management programs. You can call, we have a toll free number, 888 Ovarian. You can call anytime, 9 to 5 Central Time. It's open. So we're here to answer those questions and direct you into those resources. So our website, our phone number is available, and we encourage people to reach out.
Jennifer, what is the one message that you really hope every oncology professional remembers about supporting patients beyond just the treatment?
I love our healthcare professionals, and I specifically in ovarian cancer, it's such a tight-knit community, and they do such a great job recognizing the whole person and not just treating the disease. And recognizing that patients also need to keep going and to keep coming back to the next appointment. They really do need that emotional support, that education, those resources, and someone to kind of help navigate them through that diagnosis. Healthcare professionals that partner with organizations like ours and making supportive care a part of the routine practice can really make sure that those patients feel empowered, feel informed, and feel supported so that they are able to continue through those different stages of their journey. It's really us working together can improve not only the care of patients, but also the experience of them living with ovarian cancer. So it's not just treating, but it's also living with ovarian cancer.
The key takeaway from today's conversation is that ovarian cancer care extends beyond the clinic. Supporting patients means recognizing all of the challenges that they face outside of their treatment and connecting them with the resources that can provide education, navigation, and that overall support. And organizations like NOCC can serve as a really important extension of the healthcare team and help patients and caregivers feel supported throughout the entire stage of their journey. Jennifer, thank you so much for joining us and sharing your expertise. We really appreciate the important work that you and the National Ovarian Cancer Coalition are doing to support patients and their families affected by ovarian cancer. And we thank our listeners for joining us for this episode of STO's Voices in Oncology. To learn more about our mission and our commitment to advancing cancer care through education and collaboration, visit sto-online.org. To learn more about NOCC's resources and patient support programs, you can visit their website at ovarian.org. Thank you so much for listening to Voices in Oncology from STO.
Voices in Oncology is produced by the Society for Translational Oncology, STO, for educational and informational purposes only. Content does not constitute medical advice and should not be used as a substitute for professional clinical judgment. The views and opinions expressed by guests are their own and do not reflect the official position of STO. Mention of any product, service, organization, or therapy does not constitute an STO endorsement. Clinicians should exercise independent judgment in applying any information discussed to patient care.